All right, now this is a video for competency assessment number 2. Again, this is the laparoscopic version. So same information as before, I'll talk as I go through it, but you can find other videos with detail. So I put everything around on my Mayo stands and ring stands and back table, and everything else open is on the patient's bed. Okay? And give myself room. First flap away. Over here, I'll go ahead and open my items on this side. So I have my camera that's closest to my back table. And then I have my gown. Whoop. It's okay if it rips while you're opening it, just as long as there wasn't holes before. Wrapper's good. I feel like I'm a little too close to my camera, so I'm going to move a little further away. This is one of those where the corner is kind of hidden, so I'm going to inch my way up here and then grab the corner. Okay. All right, come over to this side. Check my indicators, good. Cover it with my hand. Open it like a hot pot. Okay. Making sure I'm far enough away from everything. That one's good. And my other one's good. Opening all my supplies, so I'll start with my towels. Wrapper's good. And my Ratex. Oh, I'll have to get another pair of Ratex. Circulator's gonna get me some. I'll just keep opening while my circulator goes and grabs some. And my suture I'm going to open. Put my second pair of gloves onto the back table. Checking my wrap as always. The circulator's awesome. She brought me more Ratex. And I checked both of my wrappers for holes. And then the last thing I need to open is my gloves. Okay. Check my wrapper. All right, again, at this point, I would go out and do my brushless scrub. We're not gonna film it, so we'll just pretend that I did my brushless scrub. You can watch the video of brushless scrubbing if you want to, okay? So I've come in, holding my arms out. And then like a claw, I gotta be careful with these gloves because they're gonna possibly slide off. Okay? Use 2 hands if you need. Ask my circulator to come up behind me and tie, please. Again, watching how close I am getting to my Mayo stand. Get in and get my left glove out and back away while I'm putting it on. Notice I'm not opening my glove wrapper the entire way. I just reach in, grab my glove, and get out. I'm not opening it. Ask my circulator to check my wrapper. The wrapper is good. I've pulled my left tie out, and on the right, she's gonna walk around me. Get my second pair of gloves on right away. And after I get my second pair of gloves on, I'm going to check any indicators on my back table that need to be checked before I bring anything else on. Because if they're not good and I bring other things on, now I've contaminated more items, right? I'll check my indicator here, and it's good. I'm gonna put that where I want it. I've got my trash, I'm gonna stick in the corner. And I'm gonna come and get my pan. So both of my indicators are all the way down at the bottom and upside down. So I'm going to use my 5mm brass spur if it works. Just grab any instrument that you think will work, watching your boundaries. Okay. I'm going to go in with the bowel rasper. That indicator's good. And my other indicator is good. Put my bowel rasper back in, watching my sleeves. Okay. I'm gonna come in. Oh, ask my circulator to check my filters. That looks good. All right. Setting this where I want it. Okay. All right. While I'm standing right here, I'm going to take my top basin out, and I'm going to ask my circulator to open me my suction irrigator. Okay. So while she's doing that, I can always get 2 towels ready for my mayo, 3 towels ready for my back table, and have 4 while my circulator's looking for my suction irrigator. All right, so I'm going to come in to get my suction irrigator out, watching my boundaries, making sure my fingers don't touch the outside of the wrapper or the edge, okay? And ask my circulator to check my pan.
That's good.
I had my back to my back table, but I was far enough away, that 12 to 18 inches, that it was okay. While I'm in here, I'm just going to go ahead and reach into my pan and get out my pottery cord, because that's going to go in. We're putting our cords in order in our basin. Then I'm going to come to my scope and my light cord. Both my indicators are good. And check these. Look at my circulator, check my wrapper. Your wrapper's good, right? Got my light cord in my pan. Set my scope next to my back table. And then I'm going to come over here and get my camera. So I'm unfolding it. My indicator's good. And I'm going to ask my circulator if she can check my wrapper, please.
It's good.
Okay. All right. All right, so now I can keep moving on here. So I'm going to go ahead, since my gowns are sitting here, put my gowns in the order that I want them in, with my gloves on the bottom, down, and then a towel. Okay. Next, I'll do my mayo stand. Then I'm going to switch to side-to-side method. Just make sure you're not getting close to your face when you switch to the side-to-side method. Ask my circulator to fix my cuff, which actually it looks pretty good. There you go. Get my 2 towels on. Do my sharp can. If I had my stickies on, I throw them in the garbage, okay? All right, I have my insulation tubing that needs to go in my basin before I can put my drapes on there. So I may as well take my scope warmer out and put it on my mayo. I'll put my insulation tubing in here. And then I don't have any light handles, so I'm gonna ask my circulator for 2 light handles. She would open them to me and I'll put them in my basin. So she's gonna get those and I'm just gonna keep going here. Yeah. Your light handles should be in your basin. Okay. So you won't have to ask for light handles. All right, I have light handles for you. All right. Thank you. Can you check my wrapper? Yes.
It's good.
All right, thank you. My light handles in there. Okay. Go ahead and take my long instruments and stick them up top. Hide my indicators on the bottom. I'm gonna put my scope in my warmer, which I will pop once my patient's in the room. Get my stringer out. Place it with the smaller instruments towards my working end. I'll hide my. Okay, so what I'm going to get out of here, I'm just going to organize all my retractors nicely so that I can see them when they're needed. Okay, I'm going to get out my adsons and my tissue forceps with teeth, and then just put my DeBakey's on my back table. My tissue forceps with teeth, I'm going to put on my mayo stand. My adsons, I'm going to put in my working corner with my knife. The reason I can do that is because we're not counting instruments, so the first time I'm touching it, I'm putting it where I want it. Okay? So then I'm going to work with my basin here. Okay? I don't need to put any of these things up on the mayo because we're only gonna have 1 stitch probably. So I'll put my suture in order of use. Okay? And the one we opened, again, you'll just put at the back. Have my focal, my marking pen, my thread that I can go ahead and put right on the mayo. Alright, and your thread, you go ahead and pretend to spray it, okay, but you can leave the bottle on your back table. Okay, alright, so I will finish setting up my mayo stand. I'm going to do 2 Kellys, 2 mayos, 2 cokers. Alright, so I've got my 2 Kellys, my 2 mayos, my 2 cokers. I'm also going to grab my suture scissors. Put those on my mayo stand. Now I'm going to ask my circulator to count with me. Okay. So this one, since it's laparoscopic, we don't have to count nearly as much. We don't have to count instruments. We have Raytex. 1, 2, start over. 1, 2, 3, 4, 5, 6, 7, 8, 9, 9, and 10. Okay, sponges, needles. I have 1, 2, 3, 4. And sharps, I have 1, 2. Okay. All right. That's everything. All right, so you can keep setting up. Your circulator is going to open items to you. Okay. I'll have a knife protector. So when my circulator, so she's standing there waiting, but I have a knife blade in my hand, so I'm going to go ahead and load my knife. And watch my boundaries, watch going in with my fingers, check the wrapper. Package is good. Okay. I'm gonna go ahead and set this on my mail stand. Package is good. Package is good. It's good. 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 So I'm gonna set these on my mail stand so the tips are towards where I'm gonna be standing. Okay. Good. Okay, so that's everything, and I'm just going to keep going here. So I need to get all of my standard instruments out. Davison jacks, 5mm blunt grasper, a Maryland, and my suction irrigator, my J-hook, which I'm just gonna stick right on the outside. Okay. So they're gonna grasp the gallbladder. Okay. Davison jacks, dissect with the Maryland. Okay. Hold it up with a 5mm blunt grasper. So my Davison jacks on the outside. Okay. And my scissors and my clipper plier.
Have your
Thank you.
knife protector that
Yep.
should have been in your basin.
Thank you.
Wrapper's good.
Thank you. Okay, so I got a knife protector on. I put my knife up on my stand here. Okay. I'm gonna have my first stitch loaded. Okay, and then I can also ask my circulator to start thinking about getting me my fluids. Okay. I'm gonna go ahead and put 2 Raytex on my mail stand. Okay, need some water, please.
I have sterile water for irrigation, 500 ml, expires September 23.
Thank you. Go ahead and make a label for my water. And I'm gonna ask my circulator for my local.
I have 1/4% marking with epinephrine, 1 to 200,000 units. It expires April 23, and I am gonna give you 30 mLs.
Okay. Can I see my local bottle one more time? Sorry. You can always ask, so 1/4% marking with epi 1 to 200,000. Okay, thank you. I need to make 1 label for my syringe and 1 for my med cup. Put my labels on. Fill the bubbles out. Okay. All right, then we're ready for our surgeon to come in.
Hello.
Doctor. Good, how are you? This is Laura Stallings, I'm a surgical technology student at Southeast Community College.
Nice to meet you, Laura. Thanks for being here today.
Again, while your circulator's tying up the back of their gown, you're pulling their cuffs down, getting their gloves ready, making a nice big cowboy hat, making sure your fingers aren't exposed. They're all tucked underneath that rim of your glove there. When they're all done gloving, we're going to ask them to dance. Pulling your tie out. Okay. All right, again, at this point, go ahead and do my square offs. Making sure I'm far enough away when I'm preparing them. I only made 2 square offs evidently. You would have had 4. So I don't have enough. I'm going to go ahead and grab 2 more. Again, push this back towards my sterile field. Watch my boundaries as I'm walking around. Then stickies on or stickies off, doctor?
Let's keep them on.
Okay. Up our hand going towards the feet. Up towards the head, we'll have the anesthesia, the circulator come up and attach our drapes to the sterile field. Bring your basin. Alright, so I've pulled up my basin to the sterile field. I'm going to hand one light handle to my surgeon. Turn your light on and aim it at the sterile field. Next we're going to do cords. So the first cord is my insufflation tubing. I'm going to leave up here the cord that I need. Hand off my end to my circulator and secure it into my pouch. Next is my camera and my light cord. Well, camera's on top. Go ahead and do my camera first. Just have a couple loops there. Get the end of my cord off. And secure my camera in. This is my light cord, making sure I'm keeping the correct end. I have a couple loops. And on the light cord. I have my cautery, which will go at the head of the patient instead of at the foot. So the cautery cord we don't need to keep as much. Weave it through here, make sure I keep enough for my surgeon. Wind it up and then pass the rest off. And my last cord is my suction irrigator. It's up to the sterile field. I have the suction tubing and the irrigator. I'm going to pass off to my circulator, and then we'll secure it into the drapes as well. Push my basin away and bring up my nails. Checking my patient's feet. Okay. I'm going to go ahead and attach my camera and my light cord. Have them ready for my surgeon while leaving them in the warmer so that my scope doesn't fog once the procedure has started. I'll leave this on the sterile field. I'm going to bring up my J-hook and attach it. Stick it in the pouch, making sure I'm not hitting anybody in the face with my suction irrigator tip. Stick that in the pouch as well. Put up my 2 sponges and stick up my thread. I'll then pull my back table up. to it if you need to. Make sure my basin stays within sterile area. Okay. All right, and then I'm going to verify that my timeout has been read.
Timeout is good.
Okay? Sharp up.
Knife down.
Alright. Then our surgeon will be ready for our camera and our light cord and our scope. So I'm gonna ask my circulator to turn on my light, please.
Light on.
Okay, and I'm gonna pull it out, aim my scope at a sponge, hit the W for white balance, which is on the right, and you're gonna watch the screen. And in the upper left corner, it's going to say white balance complete. Okay? Once I know that is done, you can actually have your circulator put the camera or the light on standby, because once you turn it back on, it will stay white balanced and at 100%. Okay? So then I'm going to hand up my first stitch for closing. My surgeon, hand them the forceps, and put scissors up for cutting, and then we can start counting. Can I count, please, circulator?
Yes, I am ready.
Okay, so I have 1, 2, Ratex up.
3, 4, 5, 6, 7, 8, 9, 10.
Needles. I have 1 that is sewing on the field. 2, 3, 4. Okay. And then sharps, I have 1 and 2 on the back table.
Okay, count is correct.
Okay, then you're going to need to tell me about your local. So I have 40% marking with epi, which is a local anesthetic for numbing and pain relief, and the epinephrine is a vasoconstrictor to help with bleeding. Okay. And then you need to tell me your 5 duties. So you can pick any of the 20-some that we taught you. I'll just say you need to separate your clean and your dirty instruments and put them in your basin, mop the floor, take care of your trash and your linens, help with the patient, take your light handles off. Okay? Lots of things you could list, and you are finished.